Learning objectives are be familiar with the evidence on the health benefits and risks of meat intake, including specific types of meat, know the dietary recommendations and guidelines for protein and meat intake, and be able to counsel patients on meat intake. I'm not going to talk about vegetarian diets per se. There's other aspects of that lifestyle that may be responsible for some of the health benefits, but I'll focus specifically on red and processed meat. Which of the following is considered red meat? Pork, dark turkey, chicken with the skin, or monkfish? Good. Majority of you got that question right. Next question. Which of the following is considered processed meat? Sliced roast beef, canned tuna, hamburger, smoked salmon. Okay, we've got good dispersion here. A little bit of a tricky question. We'll come back to that in a minute. So definitions: red meat, beef, veal, pork, lamb, horse, and deer. Processed meat is anything that's salted, cured, smoked, or fermented. So answer to the previous question, technically smoked salmon obviously would fit this category. The other foods would not. Other examples: bacon, hot dog, sausage, cold cuts, ham, or salami. And white meat is poultry, chicken or turkey. Meat does have some nutrient contributions: protein, iron, vitamin B12, certain vitamins, zinc, and other micronutrients. I'll just focus on the top three here. The other nutrients we can obtain from other sources quite readily. In terms of protein, the RDA for adults is 0.8 grams per kilo per day. It goes up a little bit during pregnancy. As you heard, for exercise, there's some more recent data that suggests that for endurance exercise, the protein intake is increased a little bit, for strength a little bit more. However, if people are exercising, they're eating more calories, so they are more likely to get more protein as well. We look at mean intakes, and this isn't recent data. There isn't a lot of recent data on this, but adult males consume about 97 grams per day. You can see the 25th to 75th percentiles there. Females, less so. And the RDA is set high enough to meet the needs of 98% of the population, the mean plus 2 standard deviations. Despite this, about 85% of men and 65% of women meet or exceed the RDA. So protein intake for most people is quite generous. 2/3 of the protein is animal or dairy, and protein intake is lowest in those over 70 years. So protein is a more critical nutrient for the elderly.